All right, today we're going to pull back the curtain on one of the most widely used medications out there, omeprazole. If you've ever dealt with that awful, fiery feeling of heartburn or been told you have an ulcer, then you'll definitely want to stick around to understand how this little capsule actually works. Let's get right into it. You know that feeling, right? That burning sensation that kind of creeps up your chest, or maybe it's a dull, nagging ache in your stomach that just won't quit? Well, these are the classic signs that your stomach acid, which is supposed to be helping you, might actually be causing some trouble. So let's start there. What's the actual problem? I mean, our bodies make this acid for a reason. So why does it sometimes need to be reined in? Well, your stomach acid is incredibly strong. It has to be to break down all the food you eat. But when you have too much of it, or it gets into places it doesn't belong, that's when the problems start. This can lead to things like GERD, which is when acid splashes back up into your esophagus, or it can cause erosive esophagitis. That's when the acid is literally damaging the lining of your throat. And of course, it can cause peptic ulcers, which are basically painful sores in your stomach lining. And that, right there, is where our topic for today enters the picture. Let's talk about the solution that millions of people turn to, omeprazole. Omeprazole is part of a family of drugs called proton pump inhibitors, or you'll usually just hear them called PPIs. Now, that name sounds super technical and complicated, I know, but its job is actually really, really simple. It's designed to hit the brakes on acid production in your stomach. That's it. And this stuff is a real workhorse. Doctors prescribe it for a whole bunch of issues. You've got your common stuff like GERD, but it's also used to treat ulcers that are caused by a specific bacteria called H. pylori. It can even prevent ulcers if you're taking certain pain relievers like NSAIDs. And it also helps with some really rare conditions like Zollinger-Ellison syndrome, where the body just goes into overdrive and produces way, way too much acid. Okay, so we know what it does, but what about how it does it? How does this little pill actually pull it off? Let's break down the science in a way that actually makes sense. The easiest way to think about it is with this acid faucet analogy. So imagine that the lining of your stomach is covered in thousands of tiny little faucets. These are your proton pumps, and their job is to drip, drip, drip acid into your stomach. What omeprazole does is it goes in, finds these little faucets, and essentially just turns them off. It blocks them. By doing that, it dramatically cuts down the amount of acid being produced, which finally gives all that damaged tissue a chance to heal. Simple, right? Okay, the science part is cool, but let's get practical. How do you actually use this medication? Because knowing the right way to take it is every bit as important as knowing how it works in the first place. Now, I want to be crystal clear here. This chart is just an example of typical doses. It is not a replacement for your doctor's specific instructions. Your dose is tailored to you and your condition. You can see how it varies, like for an infection, you might be on a higher dose twice a day for a week, but for healing an ulcer, it might be a lower dose once a day for a month or two. Always, always listen to your doctor. And here are the golden rules for taking it. You generally want to take it before a meal, because that helps it work best. And this next one is so important. Be patient. This is not like an antacid that gives you instant relief. Omeprazole needs a few days, maybe 1 to 4 days, to really build up and reach its full effect. And please, finish the entire prescription, even if you start feeling a whole lot better halfway through. Okay, let's talk about safety. And look, the goal here is not to cause any alarm. It's to empower you with the information you need so you can use this medication safely and effectively. With any medication, it's so important to know the difference between what's a pretty common minor side effect and what's a serious red flag. You might get a headache, a little nausea, or some stomach pain. That's the common stuff. But if you see signs of a severe allergic reaction or have severe watery diarrhea that won't stop, or symptoms that suggest kidney problems, that's when you need to contact your doctor right away. Now, here's something to keep in mind for the long haul. Taking omeprazole for more than 3 years, that's the key number, 3 years, has been linked to a potential difficulty in absorbing vitamin B12. So if you're on it for a long time, that's definitely something your doctor is going to want to keep an eye on. And there are a few other things to be aware of. Long-term use might also increase the risk of bone fractures. And it can interact with other common drugs, like the blood thinner clopidogrel. This is why total transparency with your doctor is non-negotiable. They need to know about every single medicine, supplement, and health condition you have, no exceptions. Which brings us to what is, without a doubt, the most important point of all. Everything we've covered today is to help you get informed and educated. It is in no way, shape, or form a substitute for professional medical advice from a real doctor who knows your health history. Please always talk to them. Whew, okay, that was a lot of info. So let's bring it all home. What are the absolute must-remember points from all of this? Let's do a quick recap. Here's the bottom line. First, remember that acid faucet analogy? Omeprazole turns down the flow. Second, take it exactly how your doctor tells you to, for the full duration. Third, know the difference between a common side effect and a serious one. And finally, keep that conversation going with your doctor, especially if you're using it long-term or taking any other meds. And hey, don't forget that lifestyle changes can make a huge difference too. At the end of the day, understanding your medication is a huge step toward taking control of your health. The whole point of this explainer is to give you the confidence and the knowledge to go to your doctor and have a really productive, well-informed conversation about what's best for you.